Hi, I'm Dan DeBow with Fuller for Congress. Today in the studio, we're hearing from Miss Fuller, who is also a registered nurse, about a few things you just might find interesting about healthcare.
We already have healthcare, free healthcare for everybody. In California, it's called Medi-Cal. Throughout the nation, it's called Medicare, and then you also have Medicaid. We have the VA system that provides free healthcare for all our armed forces. So our politicians claim, and they kind of want us to be confused and concerned about our neighbor not having health care, but it's not really true. What they're trying to sell us, which we refuse to accept, is health care insurance. How odd that they are so against insurance companies, yet they want to force us to become customers of yet more insurance companies, and not just customers, but a captive customer. And it's odd. I always ask myself, okay, if healthcare is that important to you, for my sake, why do you exempt yourself from the very same plan you're trying to sell to me as being good for me? And why is your staff exempt? Why do you allow all the big labor unions to be exempt from the very same plan you're telling us that is good for us, that we are entitled to it? Well, I say, unless you give up that Cadillac health plan that you have, and you put yourself and your wife and children under the same plan you want to force down our throat, then leave us alone. We don't want it. We want to be free people. Most of us are already happy with the health plan that we have now. And of the very few, maybe less than 15% that may not have health care, that is what Medi-Cal is for. That's why you have all these other programs like California Children's Services, or you also have the VA for our armed forces. So they are covered. As a former private business owner, I used to run a nursing home for children. You cannot do something for free. Everything costs money. It is very difficult for doctors to have a high student loan to worry about and then to be only compensated 40 cents on the dollar. What the government most likely will do to us is import foreign doctors. That means we will have treatment by doctors who perhaps can barely speak English. So we will have a language barrier. We will have doctors who are not trained to the same level as our doctors are required to be trained. We don't want you to put more burdens on us as taxpayers, and because there is already a deficit nationwide, it's going to cost even more to provide this health plan that you want to make universal, meaning that you're going to load off this debt on the next generation. It is unfair that children that are not even born yet are going to be stuck with paying for the lavish lifestyle that you want to continue to enjoy.
I trust you have found Miss Fuller's comments helpful for when you go to the polls to vote for your representative in Congress. Fuller for Congress, a leader you can trust. Go to fullerforcongress.com.